Hi, Mark White here. I'm the founder and chief cook and bottle wash for Idaho Estate Planning. Yes, I'm an attorney, and yes, we do attorney type stuff, and one of those is estate planning. And we're welcoming you to our podcast today. We have a guest, and I know you're going, thank goodness. Thank you, Mark, for having a guest. I know you think you're funny, but we're not so sure. But with us today is Gina Pannell, and Gina is with the Central District Health. And I have a lot of questions for her. Okay, maybe just several, but that's going to be involved. And so, Gina, welcome. Thank you for being here.
Thank you for having me.
Well, I know that you had to take a deep breath when you said, yeah, okay, I'll be a guest. Because it's a little nerve-wracking for the folks at the Central District Health or actually any of the other health districts right now. A lot of people are concerned and irritated, and some are, well, not as friendly. So I know that you had to take a deep breath. So thank you. Hopefully we won't go into any of those directions. We'll just talk in terms of there are people that really want to know. And so that's what we're going to address today.
Sounds great.
All right. So first of all, Central District Health. This is a health district. You told me before we got on the air, we got 7 of them in the state of Idaho.
That is correct. There are 7 health districts. They were established under Idaho code about 50 years ago. So they all serve a various number of counties. Central District Health serves 4 counties, which is Ada County, Boise County, Elmore County, and Valley County. And we have the largest population of all the health districts because we have the Treasure Valley. So of the state of Idaho, we serve about, well, under our jurisdiction is about a little over 500,000 people.
That's quite a few.
Yes, it sure is.
At least for Idaho. Since we've got the largest and there's 500,000 and all that good stuff, does that mean we have more interesting issues that you get to deal with than some of the other health districts?
We all vary in our level of involvement. Being in the epicenter, I think our health districts, our sister health districts would argue or at least confirm that we have access to the legislature more frequently. I mean, we just are our ability to work with the State Department, who is also in here in Boise, increases, but obviously with the new virtual opportunities that people have been, they've been expanded. And so people are able to build into that. We have some different positions than other health districts for various programs, but for the most part, we have some just core functions of public health when we think about environmental health. So restaurant inspections, food inspections, those types of things, septic inspections. So that's that piece. We do daycare inspections as well. And licensing. One of the things that is in our health promotions department is looking at lifestyle. So smoking cessation, behavioral health, those types of things that fall in that bucket. And then we actually have a clinical function. So under Family and Clinical Services, which is the division I work in, and we offer reproductive health, primary care, immunizations. We have an oral health program, an infant and early childhood program, parents as teachers. So we have some of that individual programmatic piece. So we work on the client level, the individual person level, as well as policy level in trying to work with, local decision makers and making communities healthier, whether that's more walkable, whether that's safer, making sure they have clean drinking water, making sure the food you eat is safe, you have access to care when you need it, are all really big functions of the health department. And this typically when we're doing our job, you don't know that we exist.
I was just going to say that, and we're not in a position to know or see all the things that you do, and that's okay, but somebody needs to do that, or there are things that can go wrong. I would think terribly wrong if somebody isn't there keeping an eye on this.
Absolutely. So typically we have been behind the scenes, and if you don't know we're here, then our job is being done correctly and people are following sort of those rules that keep people safe. So our mission and vision is to promote and protect the health of our community, and that's what we're here to do. We have a lot of partnerships with people all across our district and even statewide to just bring and elevate health and how important it is we all know, when you don't feel well, regardless of what that is, your quality of life decreases and starts to impact a bunch of other things as well. So we've been around for 50 years. Some people don't know that. We are governed by a local board of health, which is important. So as many people have learned this year with the pandemic in 2020, that they are kind of the decision makers, but they are appointed and they guide kind of the work that we do at each local level.
So you go from information to implementation to hands-on to inspection to there's a lot of things that get done.
Absolutely. Every day it's something different. Most of our funding, some people are very curious about how we operate. So we get a lot of funding through the Department of Health and Welfare. Those tend to be federal funds that maybe they get from Title 10 or just somewhere from the federal level that then is channeled to the state and given to the local level for the implementation piece. We do have county dollars that support the work that we do because of the 4 counties that we support in our jurisdiction. And then we also receive some state general funds. Some of our programs are fee related. So our clinic services we offer for individuals, whether that's, a primary care wellness visit, we charge a fee for that. We have a sliding fee scale though, that allows people who are income eligible to have that reduced rate. But like our septic inspections and things are all set through Idaho code so that we can only charge what it costs us to service. Yeah, we're definitely a not-for-profit entity. In a non-formal sense. I mean, we aren't a designated 501c3, but we're not allowed to profit off of.
Got it. No. I understand. And we have a legislature that for years and years and years has tried to be a profit. We've had a balanced budget and excess for quite a while, but we're not supposed to be for profit. So hopefully we get all that back. So, hey, thank you for all your efforts and trying to keep us safe. So that kind of leads us to the thing that's really taken a lot of attention and focus over. It's now been, well, not quite a year,
pretty
close to a year.
Yeah.
A year ago, I was at some meetings in for a group that I'm with. And we were down in Florida. We thought that was great. I had some kids living down there. So we were going, hey, this is exciting. And we turned on the game. My wife is a Utah Jazz fan. And if you don't remember, that's kind of how this all broke was Rudy Gobert, the center, was making fun of the coronavirus and people that were, he did not know it yet, but he was shortly thereafter tested positive for the coronavirus. And they shut down the NBA, and we were thinking, we're not going to make it home. Over that weekend, so many things happened, but that was a year ago next week. So a full year.
Yeah, it's been, it feels like a lot longer. If you ask people. Many people feel like they've aged also more than a year in this past 12 months. But yeah, we had our first case somewhere around March 13th or around that date. I don't know it off the top of my head here in Ada County. And ever since then, it's been, we've been in a tailspin and a whirlwind planning. One department that I didn't talk about, which is actually under environmental health, is our public health preparedness. And so they have structures in place for emergencies. And this is just a long emergency, so to speak. And so we have some excellent, like I said, structures in place to band together, create our own internal operations center so that we have our communications team, our logistics team, our epidemiology team meeting and convening. And we started that in March, knowing that this was going to be a heavy lift. I think, and most our epidemiology team was pretty well aware of what to expect in the next year. And we were all just learning because in any profession, you can't know it all. And one of the things that we were all a little naive to was the grandiose nature of how this was going to roll out and all the time and effort and energy it was going to take for our team. But luckily we have an amazing team. We're small but mighty. I think before this we had a little over 100 folks that work here, and that's from administrative staff to the director. And now we have hired on somewhere between 30 and 50 part-time staff or full-time staff to help with contact tracing. But we're very small when it comes to managing a pandemic that affects 500,000 people, right, in our district. And ever since then, we've had these ongoing connections and communications and coordinations and implementations and information sharing. I mean, you name it, and we are the source of that. And honestly, we prefer that people come to us for information and for questions. We'd rather it come from the local partner or their local health district rather than seeking information, via social media or wherever else, it can be found.
Well, hold that thought, because we're going to come back to that because, there's a lot to unpack there.
Sure.
There's a lot going on there. So, you had to ramp up. You hired some folks to help ramp up. I think what everybody wants to know a year later is that, whoa, we're done. Whew. That was a rough year. Thank goodness we got 2020 behind us and now we're done. That's not what I'm seeing, though. We're not done yet, are we?
No, we're definitely not done. We're in a better position than we were with the vaccine rollout. We know that to have those effective vaccines is a critical piece to getting this under control. So I'm sure we'll talk about that a little bit later, but we're a long way from that herd immunity, which is what we need as a community to be able to protect those who can and cannot get the vaccine or choose not to. The numbers vary. It's anywhere between depending on who you ask, 70 to 90% of the population needs to be protected to be able to, sort of stop this, not stop it in its tracks, but slow it down enough to it becomes an endemic. So it's no longer a pandemic, panic mode. It's just part of our typical life, like the flu, and we have to manage it. And with the variants coming out and the variation and effectiveness of the vaccine, although they're all amazing in such a short time frame, there's a lot still to be determined in this 2021 year.
So I'm jumping ahead a little bit. We've got a couple of variants out there. We've seen some in Idaho. How widespread is that yet? Are we just seeing a little bit? Is it getting bigger? What's going on with those?
So the first, I think the surveillance that's done, so the actual testing that's done is being ramped up by the Bureau of Laboratories. And so they are in the process of being able to test the specimens and being able to get what they need. So I can't say we have a clear picture of what that looks like. Right now it was found in the wastewater to begin with. So we knew we found it before we actually received any surveillance testing that it was here, but we all expected it. It's very contagious, and that's what viruses do, is they mutate. And so there was no surprise there. But as far as what percentage of people have certain variants, I don't know that we know that, and I don't know that we will ever have a good handle on that because it requires such rigorous testing to be able to send those specimens. And yeah, if cases remain low and few, that makes it more doable to do that. But if we ramp up to being in, red according to all national and local measures, then there's no way we'll be able to sample all of those specimens to see kind of what is increasing in the variant as far as percentage wise. But we just know that they vary in contagiousness, that we expect them to be here. And right now the vaccines are effective. So for now, those are the conversations we have.
That's the big news, right? Is vaccines are very effective even against the variants.
Yeah.
And so again, you can help us a little bit with the herd immunity concept. That is, if we can get enough people, and you were saying there's some debate over how many, but get enough people that are now immune or developed, some immunity, then it isn't going to fly through the population like it has.
Correct. Yes. So herd immunity is in the sense enough people have that level of protection or immunity from the vaccine that they can sort of stop it in its tracks. So it doesn't jump from person to person. So we were able to prevent that from happening somewhat in our state by masking and social distancing, but herd immunity will allow us to potentially reduce those measures. The goal is to not have to do this for the rest of our lives. But until we can get some level of protection, it's still unknown about how long the immunity will last from a COVID vaccine. So that's, something we will learn here in the coming months. We know that there's been a certain number of infections in the state. So there's also been people who've been exposed and had COVID, but were asymptomatic and never know. So they also have some level of immunity. And we will never, I don't know. I have a hard time believing we will ever truly know like when we've reached that herd immunity.
Right.
because there's so many variables, but we've learned and developed and rapidly figured out how to create data and information. And so we probably will get there at some point, but I can't quite get my head around what that will look like when, we can finally say, all right, we've achieved XYZ, and now we can do this, other than the cases remaining low, hospitals remaining, not impacted as much as possible, and knowing that people are healthy and getting that vaccine at rates that we know they need to keep them up, right? If it's an annual vaccine if it ends up being that way, people are continuing to come back for that vaccine year after year or every 2 years, whatever the time frame might be. And so it's, we'll learn as we go.
So yeah, first steps first. The first step is for all of us to wear a mask. I'm a firm believer in masking up. Now, under the Central District Health, we were under an order to mask up. That has been lifted.
Yes.
However, however, just because we're not under an order doesn't mean you're not advising us to still wear a mask.
Correct. So there's still a public health advisory in place, which is a little less formal, so to speak, than the order itself, but we still recommend masking. I use the analogy, and it's not perfect because you can't really make anything completely analogous to COVID, but I would still wear a seatbelt if they said the seatbelt, if I didn't have to, right? I mean, that's just something that I know is really important to do, and it protects me and everyone else in the car with me, and that would be a recommendation. So at this point in time, that is what we do recommend. It is one of the most effective measures because no one's walking around with I got a vaccine sticker and they're going to keep that on for the rest of their life. You're not going to know who's protected, who's not protected. So to be able to make sure that you yourself aren't impacted from COVID and other people are not impacted, that is one of the best things. Oh, as well as social distancing, of course.
Yes.
Which is just another component, which is, I don't know which one's more difficult, the masking or social distancing. It probably depends on the day, but and the person. But they've both been very challenging to implement, but also at the same time, there have been some really good strengths and really good mentors in the community stepping up and doing the right thing to protect the community. And that's benefited us because, we were in red, but it certainly could have been a lot worse.
Yeah, I follow it. I'm not in a high risk category yet, but I followed it. My mother is 84, so we've been concerned there. And so we're just kind of paying attention. And the consensus from the medical and scientific community, the consensus, almost unanimous, has been masking, distancing. Don't go into large groups, pay attention, be careful. None of them really recommended panic. I didn't read that in there. They said be careful, but they didn't say panic.
Yeah, I would agree. I think that's a great advice. It's just there's so many unknowns still, and we know those are effective. We know that everyone has access to be able to, either make a mask or purchase a mask. You couldn't get one maybe when this first rolled out, and you can buy one in any shape, color, size you want at this point. And that physical distancing, it is really challenging for those that want to see their loved ones. And, with the weather warming up, there's going to be more opportunities to be able to be outside. It's really that indoor where air can't really circulate as well, or it's kind of unknown how well the air quality is, that makes it more risky. And we saw that based on the cases that we, came to our state over the holidays when people were sort of stuck indoors and choosing maybe to do things to have some sense of normal. And it maybe didn't work out in their favor, that it was the safest thing for them to do.
Yeah. And that's sad. What we've learned to do, at least many people have, is we've all become a little bit more adept at technology. Even some older folks that I didn't think would ever become adept at technology have gotten pretty good. So for here in the law office, we do some in the office, everybody's masked up, and then we spray everything down. I think the finish on our conference table is dissolving in front of us. Um, but a lot of what we're doing right here with the Zoom technology, and that allowed us to keep track of mom and a few other folks. It's one thing to be on the phone. It's another thing to look at them, see how they're doing, making sure that they're okay. And so I recommend that we still do that often. If we developed a little bit of a cadence for that, we could continue doing that, would be okay.
Yeah, there's certainly silver linings to this if you look hard enough, if you're willing to see that, the color in it. And I do think even at the health department, traditionally, for example, we were very, 8 to 5 here, you need to, have your body in the building. And that's just, we're at a time and place where we were obviously very effective at conducting some very important work where many of us didn't come into the office for 6 to 8 months.
Yep.
So it's totally doable. It's not perfect, but it's manageable. People get better, they figure it out. And I do think, especially for those long distance relationships, and when you have someone who's really vulnerable, it still allows for that connection.
Yes.
Not as personal, but it's not as impersonal as a phone call or something like that. So I do think there'll be some long-term changes with society. I don't know how you go through quite this disruption and not hold on to some of the good things.
Yeah. And I noticed in my profession, a lot of training that goes on. I don't know that we'll ever get together again. The expense and the effort you go into, and here you can just click, flip the switch, and you got the camera going, and hey, here we are. And I don't know that we're going to change back from that. Some things, yes, but a lot, no. Tomorrow, I'm doing some training. I'm at home the whole day. My dog is thrilled.
Yeah, the dog's definitely won in this pandemic. All pets were very happy with this.
She doesn't know that for tomorrow yet, but she'll be thrilled that there's somebody there all day. I think we're moving from that a little bit, but the recommendation, and it's a strong recommendation, I would guess, from the board is mask up, distance, careful. Again, I don't know that anybody needs to panic, but pay attention. I think those that are employed need to pay attention. If they're not well, they should not go in. If you're not well, you shouldn't get around people, even if you mask up. It would be best to stay home.
Absolutely. And my husband and I were talking, and we weren't sick for a whole year. And I can't remember the last time I didn't have a cold. I didn't have flu symptoms. I didn't have a sore throat, and none of it. Right. And so our bodies are happy with that piece. There's a price to pay for it, but yes, the recommendations remain is we still have some work to do, and we want to get the economy back. We want to get our lives back. And as painful as this is, sometimes this is actually the fastest way to do it. Slow and steady versus this big up and down, huge spikes. Because, if more people don't mask and don't social distance, who knows what those variants will do? They only multiply and alter when they have a host to do that.
Yeah.
If we don't give them that opportunity, then we can kind of, I don't want to say stop it in its tracks, but make it slow down significantly to where it's less impactful. And that's ultimately everyone's goal, is they want to get back to, 2019 and as close as we possibly can be, and then add those silver lining pieces that they enjoyed from this experience, if there was any.
So yes, and people are so anxious to get back to whatever normal was, or whatever we think or remember normal to be, that it's really easy to run into some information or recommendations that maybe are not supported by scientific or medical experts. Work with me here. What are some things that we should just kind of be careful when? I like what you said. Maybe social media is not the most qualified source of information.
Yeah, well, we try to direct people to public health experts. So that's your local public health department, which you have, and regardless of what county you're in, you have a local public health department. They all have websites, and many have call centers to get that information. The Department of Health and Welfare and the governor's office, that coronavirus.idaho.gov website's very, very useful. They have, and I don't want to stray people away totally from social media, because if you're following like the CDC on Facebook, like I want you to go, that's who I want you to go there, for that information. I don't necessarily, like, I don't go to my car mechanic to buy meat. Like, that's just not their level of expertise. So really, when you think about who you go to for information, it should be the source of who you trust, who's got the knowledge, the skills, and the expertise. And we highly recommend that people look to local health departments, the CDC, Health and Welfare, for that type of information. And there's a variety of channels to be able to do that. It doesn't just have to be going to the website, right, and reading for yourself. When just look for the source of information when someone is making citations, and there are medical experts out there who would actually argue for both sides of this. So
Yes.
just be cautious in that, and try to, fact check, if you will, the information that they're sharing. And I would say your local health department and the CDC and Health and Welfare, again, are those sites that will give you the best information, the most up-to-date information. And what's helpful about local health department is we're people, we're not a website. There's actually staff here and who live in this community, who are invested in this community, whose neighbors live with your neighbors. And so they have that sort of personal touch versus a social media account, or, even the CDC. It just seems so far-fetched sometimes because it's just this far off entity, but we funnel the same type of information and, have bodies to actually talk to on the phone through a call center. Like, if people are having questions, I really encourage them to reach out. That's what we're here for. And we have managed the call center from the get-go, from when people were on the same flight as the person who had the first case, to I want a vaccine yesterday and I'm mad I can't get one. I mean, we have covered the spectrum of that, helped people manage the different orders. You talked about our local health order, then you have the governor's order, then you have city mandates and city orders. I mean, it is really complicated, and it's hard. It's hard enough for us in the weeds to kind of get our hands around, who sort of has the authority. But at the end of the day, we have the information that you need, and we ask that you, at least look to that as a fact-checking source. If that's not your main source, that you go to them for clarifying questions. And so social media, again, there's one avenue of that, but I would balance it out. If you're going to follow your neighbor's advice about that, then maybe look at what CDH is saying at the same time. And then you have at least both sides of the spectrum, and you can help make that decision for yourself.
What I found actually not that interesting, or certainly not unexpected, is that when I visit with my personal medical people, family doc, allergist, dentist, you know what? They were all in agreement with you. I don't understand that. Why? No, that's exactly right. When I asked them, and, I'd push them a little bit and dig in, and, every person that I know that's in the medical community providing medical care, they were, I gotta say, 99, 100% in step with the recommendations from the CDC and our health department, so our health district. So I think that goes a long way.
It really does. And, I was, and sort of still fill in, but I was the school liaison. And as we know, school reopenings were very emotional, very sensitive topic.
Difficult.
A lot of families. And when I met with the Boise School District Board of Trustees, it was myself and Dr. Bramwell and Dr. Nasser, and they're each at different health systems here in Boise. And we did not have a preparatory conversation. We did not have any pre-dialogue prior to that particular meeting. And we showed up and we were in lockstep the entire time with what is safest, what's best practice, what we're recommending, what you need to be on the lookout for. So to your point, it's, yes, those are definitely individuals that you should look to. If you have a primary care doctor, ask them those questions about whether it's just COVID in general or the vaccine. They are great experts in this. And in public health, sometimes what we see is there's a little clinical focus as far as the clinical outcomes of COVID. And one of the benefits of having this fall within public health is we recognize that there are going to be short and long-term impacts from COVID. And we're not just, the morbidities and the mortality, so the deaths and then the diseases that are caused or these ongoing burdens to someone's health are really important as a result of COVID. And we want to make sure that we're monitoring that and we're careful and we're protecting those people. At the same time, we also recognize the value of education, of food security, of social interaction. Like, we're able to balance that. And I'm not saying medical professionals aren't, but we are in the field of public health where we have the entire public in our hands at all times, thinking about all of those things that impact their well-being. And, we get it, and we get what sacrifices this is that people are making and what it's doing to their own personal satisfaction and well-being and health. And it's a big deal, and it's hard for people to do. And we really appreciate those people who've masked up, social distance, and will continue to do so.
Yes, my thanks as well. Because I know mask maybe helps me a little bit, but it's your mask that helps me even more. So I thank all of those that are masked up. I go to the store and they're masked up, and I appreciate that.
Yes.
Because that's what allows us to go to a store, is that people by and large are following those recommendations. So thank you.
Yes.
All right, so I want to talk about myths or misinformation or misconceptions that people might have. I think there's two levels. There's maybe some about the coronavirus or COVID first, and then we can follow that up with a number that I've seen, read, or heard as far as the vaccines.
Sure.
Second, so what have you got for us? What are some of the myths or misunderstandings that are, kind of circulating out there around the COVID?
Yeah, well, I think one of them is that it's over. So we think we addressed that. The other one that comes to us often is that this is just like the flu. And it's the big deal. And it's absolutely much different than the flu for a number of reasons. One, when we look at so there's always this, and I can't think of the technical term off the top of my head, but it's the case rate, which the number of deaths per 100,000 or however you want to term that. And COVID is 10 times higher than that of the flu, which many people, when this first started, it has similar symptoms of the flu, of course,
right,
which makes that, you want to make that parallel, but it's more deadly and it's more debilitating. So we see a lot of chronic organ damage as a result of this. It's impacting younger families and younger folks versus the flu tends to get, really small young children and then, the elderly. But we have people across the spectrum and we've seen stories, anywhere you look in any state, there's a story about either a mom who's now on oxygen or someone who lost a very young father. It's just, and you don't really know your risk for sure. You know that it goes up with age, but anyone can be impacted from this disease. And so I think it's important for people to understand why and how it's different prior to the vaccine. We had a vaccine for the flu and we didn't have one for COVID. So that made a big difference as well. And we
knew what the flu looked like, not just now, but down the road. We knew what to expect. And so we've developed those systems.
Yeah,
we didn't have that with coronavirus.
No, we didn't. And one of the biggest red flags of coronavirus is the fact that you can spread it and not know it. And I heard a statistic the other day was that 50% of the people who spread it don't know they have it. And that's a big percentage.
Oh, I don't like that.
And I don't, again, and I'm not going to quote it specifically because I heard it, just in a conversation, but it came from a physician who's very well versed in this. And so that is just very concerning. And when we do our contact tracing, people don't know because it's 48 hours from the onset of symptoms. And when you feel fine, of course, you're going to kind of maybe be a little more lax or tend to be a little more lax in your preventative measures. And that's not something that happens with the flu or other viruses. You have symptoms and you're sick and you're contagious. And with this, you have 2 whole days to pass that on to somebody without knowing. And it's usually loved ones and friends. It's not strangers. It's people in your household, people at a gathering that and that's a hard pill to swallow when at the end of the day that maybe you passed it off, whether that person is fine or not, that may make you feel different, but that you passed it off and you had an opportunity to protect them, that's a pretty heavy thing to carry around.
And we've just crossed the 500,000 mark.
Yes.
As far as, casualties.
Yes.
That's huge. I don't think we've lost that many with the flu in any flu season.
No, and I'm not a social media person other than I do have an Instagram account and I look at it occasionally, and I was on the American Public Health Association. I follow them, and they had some statistics about the number of flu deaths per year compared to COVID, and it is a very small percentage. And I don't want to quote it because I don't have it right here in front of me, but we've definitely surpassed any flu year. Probably ever, other than I don't know about the Spanish flu necessarily in 100 years ago, but for ongoing flu seasons every single year, this has far exceeded deaths in like you said, almost less than a year, or just almost a year.
Yeah, and so that's the first thing. It is not like the flu.
Correct.
And I'm sorry, there are some folks that are trying really hard to make it like the flu. I'll assume for a moment that they're people of goodwill and, are just scared or concerned or want it to go away. But we might want to pay attention to the fact this is not the flu. This is something completely different.
Yeah.
What else you got for us?
I think we touched on them because people think that masks and things don't need to be worn now that the vaccine is rolled out, and that's not something that we're recommending at this time. Those are the main ones that we see come through our call center and just in conversations. I couldn't think of anything that was more themed. There's some odd ones out there, but they're not really things we hear consistently across the board. So that pretty much, I would say, covers the ones that I thought we'd talk about today.
So let's talk about vaccines for a moment. I really, hats off to the countless numbers of folks that rolled up their sleeves and jumped into this thing. You can't do this without a lot of people working really hard with a common goal. We're going to make this work, and they have. This is amazing.
Yeah, I sometimes call it a miracle, but I don't want to discount all the science and effort behind it. But honestly, to have an effective vaccine in less than a year is just a miracle, and we need to be honored to have had the science and the structures in place to be able to do that. So one myth we do hear is it happens so fast it's not real. Like they skipped steps. And it followed all the same protocols. They just ramped up the number of people in the test where they would maybe make that a little bit slower. They just bulked up those individual group sizes.
And thank you to them
who
volunteered.
Yes. Yeah, without them, and we'll need more. We'll need more for pregnant women. We'll need more for kids. I mean, we still have a ways to go. That's a population that hasn't been tested yet. So that is a myth out there that that you shouldn't trust it because of the timeline. And it's typically 10 to 15 years to create a vaccine. But we had the structures in place. Some of the pieces, the manufacturing, those things were luckily there. And this had been studied before, and vaccines were attempting to be made. And this just obviously expedited it. And what you also saw is sort of a united front with private, public, government entities coming together, where typically they would be competing tit for tat with all things related to production and profit. And that is not what we saw. We saw a lot of collaboration, which is a benefit to us, obviously.
I'm with you. It is a miracle. Miracles can reside where there's lots of science, because there's still a lot of coincidences that had to happen, a lot of things that we happen to have in place. So, What are some of the other myths around the vaccines?
So a couple things we hear is that it changes your DNA because
Oh,
it's an
yeah.
mRNA, which that's not true. It doesn't enter your DNA and alter your DNA. So that's just fact. There's lots of really good information out there about like little quick videos about what, and I say, careful on what you Google, but YouTube has some good, very visual descriptions of like what is mRNA, like an actual fact by fact check. So that's something that would be helpful for people to go through. I'm not an expert in it, but I've heard our medical director give the presentation a number of times, and it's not something that people should be concerned about because it does not alter the DNA. So that's one of them. The other one that I want to talk about is that you can get COVID from the vaccine, which is not true.
Oh, yeah. Yeah.
But we hear that a lot as people concerned about being able to get it, and it protects you. It allows that immunity for it to develop after your first and then second dose for the booster, and you get to have that level of immunity without actually getting infected. So that is the huge benefit, because you don't know what will happen if you get the virus versus the vaccine itself will not give you COVID, which I don't know. That's my preference versus the alternative.
And of course, there's all kinds of other bits of misinformation involved with every vaccine. There are folks that are firmly against vaccines or vaccinating themselves and their kids. So that's still all out there. We're assuming, though, that those that want to know can get really good information about this.
Yes, they can. And honestly, it's out there, like I said, on the CDC. If you look at the ACIP, which is the National Immunization Advisory Council on Immunization Practices. So that's a great resource for people to go to. The manufacturers of the vaccines themselves have fact sheets. So if you want the right information, it's available for you. And we also, on our YouTube page, at the Central District Health YouTube page, have a recording from our medical director and one of our physician assistants walking through. The first part is about the vaccine and how it works and how it was kind of developed in that process. And the second part is about the vaccine rollout, because we were knee deep in that, and we still are, but in January and early February. So it just kind of talks about that process and what our role is. So it's really helpful, just so your listeners can look into that if that's something that's valuable.
Very
it's
good.
Long.
So where are we now with the rollout? Seems like there have been a lot of people that have received their shots.
So it's a work in progress. We anticipate we're through about 50% of the way through 2.2. So that includes the 65 and older and everyone above them who is included in that. And I can, it's a hospital staff. I have it here. Hospital staff. It could be some of those outpatient staff, long-term care, your EMS staff. The biggest bulk of group was about 80,000. I'll speak for Central District Health, anticipated for the 65 and older. That's a big chunk of people that would be eligible if they wanted to receive the vaccine. And we think, based on what we saw, and this was data from last week from the state, that we're about 50% of the way through, which that's good news. We are overwhelmed at the call center, and it's a little bit better just because of the rollout. It comes down to supply and demand. We just don't get enough doses in the state, which makes it really challenging for people to get a vaccine when they want one. But we are, we're not a big state compared to others, so we don't get tons of coming to Idaho like many others do. And so the state gets information from the federal government about how many doses they'll get per week, how many doses of Moderna, how many doses of Pfizer, and we allocate that number to our vaccinating providers who have signed up, and they have to register through the state to be able to say that they're going to store it, they're going to inventory it, monitor it, kind of follow the same procedure, attest to following the subgroups that have been lined out from the governor. And we at the health department do not have a say in those subgroups. We just follow what the Coronavirus Vaccine Advisory Committee, which is our Idaho committee, and what the governor signs off on. We can't come around and say, well, we want to put 65 and older above teachers. Like we don't get that authority. We just follow the rollout for the state, and every health district is the same. I do believe that we anticipate the new subgroup, which is going to be the essential workers, like your grocery store workers and some of those others, to open up in the middle of March. So
Okay.
we do encourage, if you are in the group above them, that you look to try to get an appointment and communicate with your pharmacy, where you would go maybe to get your flu vaccine, where you go to your primary care. Look for pop-up clinics that happen. Sometimes St. Al's and Primary Health, they hold these pop-up clinics, and you still have to make an appointment, but we know this other group will open up, and it could cause a challenge for anyone in the groups above them to get vaccinated. So that's something we learned today, and the middle of March is not that far away.
So I know this is truly an inexact science. I get this. Some thoughts on when we'll have rolled out what we think we're going to be able to roll out? Do we know the timing on that?
Yeah, it is not an exact science. I'm looking at the most recent timeline, and it says the general public will be likely available to get the vaccine until, in April or May. So that will depend on the production from Pfizer and Moderna. And then now that Janssen, or Johnson & Johnson, however you want to call it, either one, is approved, then that would be an additional vaccine allotment that the state will begin getting. So it could be, I would say that it could be sooner than April and May, but those are probably still really good timelines based on what we know now. It also comes down to take-up rates. So it depends on how many people are willing to get the vaccine and how quickly we can administer. And when we started, Idaho was not great. Most states, weren't, but for some reason we hit like the bottom 40 to 50, 40 out of 50 or 45 out of 50. And we are up in the top 10 now. So our state is doing an incredible job. We have great partners with anything this large. It just takes time to mobilize. It takes time to create your systems and your processes. And so we're getting better and better with it every day, every minute almost. And we have great partners out there, like you said, that have stepped up. Lots of volunteers willing to show up and vaccinate, or, take temperatures, or, run through screening questionnaires, whatever it might be. So I would say in general that April to May timeline probably is reasonable, pending no disruption in production, which we don't anticipate, but you never know.
And then how much longer after that? Were we going to be giving vaccines for the rest of the year?
Well, I would say that what we have seen, based on what we've seen so far, is there's a lot of hesitation for some people to go first. So some other people have been able to go first, and we have other people now who are interested, now that their colleagues have been able to get vaccinated and, got to observe nothing happened to them, and they're fine. So yes, I would anticipate we're going to be vaccinating for the rest of the year. It will take a while to roll up that into that herd immunity. We won't achieve it this year because we have a whole youth population, which makes up a large percentage. We're not going to get there. And we don't anticipate, last I heard, and at least till the end of this year and early next year, to have something available for youth. We all know that could change, but based on what we know now, then that's where we're at. So I do think it will be long-term this year, where you would be able to go into your primary care doctor and get it if you didn't kind of jump into the boat when it first came around for you to be eligible, and that we'll just continue that. And, one thing, I guess, I don't know that it's a myth, but there's a lot of conversation about, like, okay, so when can we say we're done with the pandemic? Like, when is it? And we will eventually hit a point where it's just part of our life. That's moving from that pandemic to endemic. But coronavirus is here to stay. It's going to be here probably for the rest of our lives. There will be people dying in hospitals of COVID in 2 years, 3 years, 4 years, 5 years, unless we eradicate it. And I don't know that we'll get there. People may have different opinions, but that's really hard. We haven't eradicated, any virus except one, right? Smallpox maybe. So it will be here, but we can reduce the risk significantly. We can keep ourselves protected, and that herd immunity is really something that will help us be able to do that again, because if we don't give this virus a host to hold on to and replicate and mutate, that is our best defense, which is why those, they're called non-pharmaceutical interventions. So we didn't have a vaccine, so we did masking and distancing and disinfecting that's the tools we had. And now we do all those things plus masking to make it happen even quicker. But I think we'll be vaccinating for years to come, in my opinion. But it's hard to say. I can't forecast that. I wouldn't put money on it.
No,
But
I understand. We happen to be in a little bit different demographic, political arena now than when we were trying to get rid of smallpox.
correct.
And so that could make this whole thing a little bit more difficult. All right, so good news is we're moving forward, we're making great progress. I think that's good news. I think we have to say that. We've made tremendous progress. The downside is we're not quite there. We've got some folks who have been doing really well, staying at home, limiting their contacts. Do you have resources on your website for people that maybe are dealing with some other challenges from this, say the non-COVID challenges? There's, emotional and mental, and, there's some other things going on.
We have some of those resources. Absolutely. I know that the state has a great website. It's called the Covent Helpline. And I have that number I can say here, which is to call or text 986-867-1073. And they, they're trying to handle through the Office of Emergency Management just some of those stressors that happened as a result of this. So that's a great resource. 211 is a great resource, which is an Idaho resource number for the department. And then also our call center can help you. We do have services here. Like I said, we have primary care services. We have a provider that sees people for mental health. We have an infant and early childhood mental health program to help those families who maybe you had a baby during a pandemic and you lost all social connection and you're really struggling making any connection with your baby or your husband or whatever. And so there are resources out there, and we can put you in touch with those. And our website is one way to find that, as well as I would say that that phone number. And there's a website for that now too, but I won't read it out because it's kind of lengthy. But I'm happy to share it with you if you'd like.
A recommendation that I give when I get on here is be in touch with your family, reach out, talk to people, check in on people. Maybe you're checking in on somebody and they're checking in on you. Perfect. Visit, talk, communicate, socialize. I realize that social media has, some challenges, but it can be an opportunity for people to connect. So all of that activity, I think, is still good. Don't get caught up in all of the misinformation that's out there, but certainly connect with your family, like their pictures. That's great. Although I've seen so many pictures of dogs, I'm just... My wife is on, we have a yellow lab, and she's on this Facebook page group called Labs Unlimited. And labs are great sources of entertainment. I'll just put it that way. And especially as they write up these stories about their dogs, oh my gosh, it's funny. So that's not a bad way to communicate. We can connect with people. I would counsel people not to get going down some of those rabbit holes. That can be very difficult and disconcerting.
Yeah, and that's funny you say that, because I talked about our health district operations. So we meet every three days, or sorry, Monday, Wednesday, Friday, 3 days a week, and we start with a pet picture because it just kind of breaks that ice with the challenges that we're facing, whether it's a bird or a rat or a dog, it doesn't really matter, So we try to bring that in. It's heavy work, and we know that we need to have that light at the end of the tunnel. And I would say, with the weather getting better, go outside,
Get outside.
Be with your friends if you want, but sit in a circle and space out. That's totally appropriate and much needed, and will make you feel rejuvenated. Plus that vitamin D, you can never really, in my opinion, get enough of it as long as you're protected. But the winter months are the hardest because you had to stay inside, and for those people especially who don't deal well with the cold. But that would be my recommendation: is get out, go for a walk, and then find a space for connecting with the people you love. It's okay to do that. Just don't cram, your family of 50 in a small condo. That's not really something we would recommend.
Please don't do that. And you know what? Getting a little bit more sunlight every day, just a
Yeah.
little bit, and that's not hurting. Um, where should we go to get information about getting the vaccine,
Yes.
finding out what's going on? Give us, what are the best resources to be looking at?
Absolutely. So if you go to cdh.idaho.gov, we have, you'll see little banners and it will be, first one you see is COVID information. And from there, it will take you to a link where you can look at COVID vaccine information. And that includes efficacy. It includes a list of providers that are currently vaccinating, and that's updated every week. Includes hyperlinks if they have an online registration, as well as phone numbers if they're taking phone reservations. And we keep that, like I said, updated weekly to make sure that, because we're allocating those doses as a health district, we know where they're going. And then there's also doses coming in from the federal government to certain pharmacies. So be on the lookout. We try to keep that information in our call center. So that might be a better way, but we're never 100% sure where those doses are going. So we'll get to a point, I think, where we will be able to list that information, but our call center keeps more up to date with that. And I would say those, and I know that Health and Welfare has a website, but I believe it just takes you to our website. So that's, but if you are not in our health
You
district,
have the better website.
well, and if you're not in our health district, which you have probably listeners maybe throughout Idaho, then I would say the Health and Welfare website will take you to your local health district or wherever you can find that information for local vaccine.
Okay, so the website again is cdh.idaho.gov.
Yep.
And then you gave us a phone number. Could you give that to us again, maybe twice?
Yeah, so I'll give you the COVID Help Now line, which is
Okay.
the 986-867-1073. And you can call or text that number. And that's for Idahoans feeling impact from COVID. And then our call center here at Central District Health is 208-321-2222. Very easy to remember, but
That's a hard one.
but yeah, either one of those would be great for people who'd like to reach out and honestly have someone to talk to on the other line.
Very good. Hey, Gina, that was a lot of information in a short period of time. I can tell that you're kind of used to that you're trying to get the message out there. And again, I think for a lot of folks that are listening in, it's not the end of the world. We're getting through this. A lot of very, very good things going on. We just need to hang in there a little bit longer. I think we'll get there.
Yeah, we are very hopeful. We're very thankful for the community to show up and do what's right, and we can get there together so we can get out of it together.
Very good. Hey, thank you for your time. It was very, very much appreciated and timely. And I'll check in with you later to see the progress, and then we can report it back to the folks that are listening in today. So have a great day, everybody that's listening in. Thank you for joining us. And if you want to share this link, shoot it around, let people know this is good information, not just for us that listen in, but for some of those folks that shoot it around, let people in on it. All right, thank you. Have a great day.